Now this pandemic is getting serious. A major college football team just canceled its season. I'm Scott Ott, and this is Bill Whittle Now. And Bill, when I use the term major college football program, I should probably just substitute UConn. The University of Connecticut Huskies, who for their last
Make
three
up your
seasons...
mind.
That's right. It's got to be one or the other. This is the first FBS team, according to ESPN's coverage, that has announced that they're suspending their season. The Huskies went 2-10 last season, and they're actually in the process of leaving the American Athletic Conference. They're going to go. They were planning to be an independent team this season, and then they're going into the Big East. But Bill, they've decided that they're not going to play at all in 2020, and there's going to their students will still go to class. They'll still have benefit of whatever football benefits they had as college students, including access to facilities and support services. But they're not going to play football. I guess if I were the athletic director at UConn, I would have waited until one other team did this rather than be the first one, so that the whole country must know that in the last 3 years, we've won 6 games and lost 30. But Bill, what is your view on the ability of colleges to continue this, COVID-19 party in a football bowl that was going to be the 2020 college football season?
I have seen a few institutions, private institutions, businesses, and so on, that were in trouble to begin with, or whatever, for whatever reason, and COVID-19 has been just a wonderful fig leaf for them for whatever particular reason. But I have to tell you, when you told me, when you're setting up the story, my first thought remains my thought, which is, well, that's just swell, UConn. What about all of the other teams that have you scheduled for their upcoming football season?
Well, here's the thing about that. I'm glad you brought that up, because before they made this announcement, already 4 of their games had been canceled because of rescheduling decisions by the teams' leagues for those other teams, including they were going to have away games at Illinois and Ole Miss. They were going to be home against Indiana and their perennial rival Maine. Those games had already been canceled, so your 4 games out of the season were already down.
It seems to me that as a member of the National Collegiate Athletic Association, NCAA football, I think I got the acronym right, but chances are I probably didn't. But as a member, I know NCAA. If you're a member of NCAA football, this seems like this should be a decision that the NCAA should make. This is a decision that look, if college decides it doesn't want to play NCAA ball anymore, that's fine. But I don't think you just get to walk out on a schedule and leave everybody else hanging. These schedules are usually put together 2, 3, 4, 5 years in advance, in many cases, sometimes longer than that. And while you can occasionally scramble in a case of a situation where, a team for whatever reason either can't make it to that particular game, or in the case of like a big tragedy, as we saw years back when a football team's, plane goes down or something like that. Yeah. Then you can scramble and basically kind of just fill in the slots, but to simply walk away from your obligations, I think is just plain wrong. And I think this is a decision that the NCAA needs to make, and probably needs to make pretty soon. And I think when they're basically making this decision, I would really be interested to know what the percent, if you're going to, well, there are 2 different cases here, right? One case is you have the regular football season as usual with the stands full of students, and it doesn't look like that's going to happen. And the other one is you basically go down there and play on an empty field, and most everybody who watches the football game watches it on TV anyway. I would be curious to know statistically what the number of COVID-19 fatalities are among extraordinarily healthy young athletes aged, 18 to 22. I'd be willing to bet you it's 0. And so when you see things like this to me, this canceling of things like football season and sports and so on is again an example of the inflexibility of government in general, of authority in general, to make allowances for the particular environment that we're dealing with. there's an enormous catastrophic difference in risk between the rules you would set down for people who live in a nursing home versus those who are playing college football, for God's sake. In the case of this particular virus, the virus is extremely clear now that it preys essentially on people with compromised or coexisting comorbidity, other diseases that have weakened them or so on.
Well, Bill, that's who it affects to the greatest degree, but that's not who it infects to the greatest degree. And it seems like even if these players got together, I mean, Major League Baseball and basketball are trying to carry out seasons as well, but they're finding that they almost have to lock people in a compound and do, daily testing to make sure they're not carrying. Because if you're in contact with anybody else, including your geezer boomer teachers at the university, then you run the risk of taking that disease that would only slightly hamper you and killing other people with it.
You run the same risk when you go into a supermarket to buy food and you pick up and touch objects that other people had picked up and touched just a few minutes ago. This is the entire problem with this pandemic. And by the way, this is the problem with the pandemic, is that for whatever reason of the roll of the dice, this COVID-19 is deadly enough to be serious, but not so deadly as to be like prima facie on its face. Oh my God, people are dropping dead in the streets. Look, this is a decision that we have to make as a society. We should have made this decision 4 months ago. It still hasn't been made. It's not even been discussed. But basically, the discussion that this country should have been having from the beginning in March was this: at what point does the damage the cure does exceed the damage that the disease does? And I think this is a great example of exactly that case. You have now got in the world, not just in America, there is now a new way to die. Thanks to the Communist Party of China, there's a new way to die out there. If you are in the age group of people who go to colleges, the chance of that affecting you is so close to zero that might as well be zero.
Well, Bill, I think you could acknowledge
you're right. You can affect.
Both you and I are not public health officials, but this team consulted with
which means we've got at least a chance of being right on this one.
They consulted with state and public health officials and with the student athletes who are on the team. And this is a quote from the athletic director at UConn. Quote, "The safety challenges created by COVID-19 place our football student athletes at an unacceptable level of risk." Are you saying he's lying or he's just stupid?
I don't think he's lying or he's stupid. I just think he's a bit of a wimp.
Suck it up and take your COVID like everybody else?
So, I'm serious. Yeah, I'm sorry. I really do think that it's not just a question of like, I'm at this point now, but this is the conversation that we needed to have had months ago, and we need to have more every single day. This was never, ever about we are going to lock ourselves into our tornado shelters or our nuclear fallout shelters, and we're going to come out in the summer of 2021 when there is a vaccine. This was never, ever about that. But that's how we're talking about it now. And that is how we continue to talk about it. This is not reasonable thinking. This is precisely the kind of thing described in Popular Delusions and the Madness of Crowds. This is Extraordinary Popular Delusions and the Madness of Crowds is an amazing book that talks about all the times that entire societies have lost their minds. And people look back on it like, what were we thinking? This discussion has never been real because we live in an age of social media where any realistic discussion about any realistic problem immediately devolves into, well, you're just trying to kill my grandmother, or you're Nazi who's in favor of genocide. And furthermore, here are the people you're trying to kill. There's a new way to die in the world. Thank you very much, CCP. Now, what are we going to do about it? How many people does it affect? What percentage of people does it affect by age? What are we going to do? And we were never, ever willing, certainly in the beginning of this, to say, we're just going to stop doing everything for a year. So yeah, I am saying let's go out there and take our licks. That's basically what I'm saying. I'm saying, yes, congratulations. We have reduced yellow fever. It's not even on the list anymore. Smallpox, gone. Tuberculosis, gone. Cholera, gone. Typhoid, gone. Now here's a new one. We talk about this as if we have a right, that's a constitutional and legally defensible right to live a life without any fear or any harm or anything bad happening to us at all. And there comes a point when we simply have to say, look, this is the world, and this is the world we live in. This is the world we've been given. And on some level, yes, it's not as nice as the world that was in 2019, but the world in 2019 was so absurdly, insanely nice to begin with that there's no reason that we should ever possibly expect to have to live up to those kind of standards. And we weren't grateful for 2019 when we had it. So, yeah, I'm sorry about all this. It's tough news, but I go out every day as everybody else in this city does. They're told they're not supposed to, but they do. They take their chances like everybody else. They do smart things like wearing a mask to reduce the spread when they're around people. And when they're sitting with friends in restaurants, they don't. And no one has had this discussion about the fact that, yes, people are going to die and have died and will continue to die. And that is a catastrophe. And we know who to blame for that particular catastrophe. But this is not 2019. And we are no longer, nor should we ever, have been in a situation where we've decided we're just simply going to stop the heart of this country. It's going to go into cardiac arrest until it's safe to come out from our holes again.
The members of BillWhittle.com have funded this program and made it possible for you to watch it for free, but you don't have to continue to be one of those who's enjoying this program because of the ministrations of others. You can become one of those who's spreading this song of liberty around the world. If you'd like to join us or just check us out, go to BillWhittle.com. When you get to the point, which I think you will, that you want to join, click the big green Become a Member button. For Bill Whittle, I'm Scott Ott. Thanks for watching.